So this is the lecture number 2 and I'm Dr. Rythm, and today we're going to discuss about the rhythm and the rate. Okay. So what do we mean by the rhythm? You know that our heart that beats in a rhythmic fashion, and that is a sinus rhythm. So that's there are two words now, the sinus and the rhythm. So the rhythm means that is in a rhythmic fashion, okay, and the sinus means that the impulse is coming from the SA node. Okay, in a layman term, how do I say it is that the current in your heart is following its natural pathway. Okay, it originates from the SC node, goes down to the atria to the AV node, and from the AV node through the bundle of his to the right and left bundle branch into the Purkinje fibers. So this is called sinus rhythm. So the characteristics of sinus rhythm are that every P, for every P there is a QRS. Okay, means that the QRS is preceded by P wave. Every QRS is preceded by a P wave. Then this PR interval here, this PR interval from the start of the P wave to the start of the Q wave, that is constant. That's the second thing. The first thing is that P is followed by a QRS, or you can say in the other words that a QRS, every QRS is preceded by a P wave. The second thing is PR interval is the constant. Okay, and the third thing is that the morphology of the P wave, that is normal. Okay, and that is normal. And the fourth thing is that for a sinus rhythm, that the RR interval, what I have shown over here, from one R to the other, it's equal. If this RR interval is not equal, but the rest of the things are there, so it will be called sinus arrhythmia. Okay, it will be still sinus, but it's not no more in a rhythm. Now it's arrhythmia. But as the current is originating from the P wave, from the sinus node, okay, so it will be the sinus arrhythmia. How we gonna come to know about that? Because every P is there and every QRS that is preceded by a P wave, okay, and the PR interval is constant and the P morphology is normal. This means that the current is originating. If you judge on these three things, okay, this means that the current is originating from the SA node, and this means that it's a sinus. Now you need to know that it's a rhythm or that's arrhythmia, that is on the RR interval. If this RR interval is constant everywhere, okay, it's equal, that means it's in the rhythm. So it's sinus arrhythmia, otherwise that's going to be the sinus arrhythmia. So the regular rhythm is like sinus rhythm, okay, and the irregular rhythm could be the sinus arrhythmia, or it could be the atrial fibrillation, ventricular fibrillation, or in the blocks. Let me show you a picture of the sinus rhythm. Let's have a look on this strip. Actually, you can see that the P wave is there, and this P wave is followed by a QRS complex over here, okay, and PR, okay, if we see the PR interval over here and the PR interval, they seem constant, okay, the P waves are same, their morphologies are same. QRS is preceded by the P wave over here, this QRS is preceded by P wave, and we do not have the other RR intervals over here, but let's assume that they are constant. So this is a perfectly a normal sinus rhythm. Let's see is it on the original ECG strip. So here you can see this is a perfectly sinus rhythm, and let's find it out on what we have already discussed. Okay, the first thing is that the P wave, okay, this is the P wave and this is QRS. So for every QRS there is a P. For every QRS that is preceded by a P, P followed by QRS. In other terms, P followed by QRS, P followed by QRS. That was the first thing. Now look at the PR interval. The PR interval over here, that is constant, PR is constant everywhere, like it's the same. Okay, that's the second thing. And the P wave morphology, if we look, that's the third point, it's the same everywhere. So that is sinus. Okay, now it's a rhythm or arrhythmia, we're going to look at the RR interval. So RR interval over here, 1 2 3 4 small boxes, 1 2 3 4 small boxes, large boxes, 1 2 3 4 large boxes. So RR interval is the constant. So it was sinus, and now the RR is equal, so it's in the rhythm. So it is a sinus rhythm ECG. Simple as that. Hope that's clear. Now, if we look at this ECG, let's analyze this thing. So every P is followed by QRS. P is followed by the QRS. Okay, P followed by the QRS. It's there. Okay. The second thing is the PR interval. The PR interval seems constant everywhere. Okay, and the P wave morphology, it's the same everywhere. Okay, so it's a sinus. Okay, now we're going to define the other thing, that is sinus rhythm or sinus arrhythmia. So the RR interval you're going to see over here, it's not constant. Here it's much more as compared to the first two one. It's 1, 2, 3, 4.5 over here, but it's 1, 2, 3, 4, 5 and 6.5 over here, and a little bit more over here. So it is sinus arrhythmia. Now, if we talk about the heart rate, the normal heart rate is between 60 to 100. Anything that is less than 60 is called the bradycardia, and anything that is above 100, that is called tachycardia. Okay, and if it's in a sinus rhythm, we call it sinus bradycardia and sinus tachycardia, respectively. Now, to calculate a rate on the ECG, okay, you need to look at the RR interval. Okay, the RR interval. Now the thing is, actually, this is the RR interval, from one R to the other. Now, to calculate a rate, you have to first look at the thing whether the RR interval is equal or not. If the RR interval is equal, there's a separate method of calculating the heart rate. If the RR interval is not equal everywhere, there's a different method. So say, for example, in our ECG, like when we are actually having over here is RR interval, you can see that it's constant everywhere, it's equal. So in such a case, what you're gonna do is that you need to calculate the number of large boxes between the two R's. Say, for example, we calculate it over here. This is 1, 2, 3, 4, and 5. Okay, so what you need to do is 300 divided by the number of large boxes between the two RR. Remember, the large boxes, not the small boxes. Okay, so if you're going to calculate that one, okay, what will be the answer? It's 60. Okay, it's 60. So the heart rate in this ECG is 60. How I did it? 300 is a constant number, okay, divided by the number of large boxes between the two RR. Okay, this is in the case where the RR is constant. Okay, if the RR is not constant, like in the sinus arrhythmia, there's a different method. Okay, let's see on another ECG and calculate the heart rate again. So this is another ECG. Okay, so we see that the RR seems constant everywhere. Okay, so let's calculate the number of large boxes between two RR. So it's 1, 2, 3, and the 4. So we had 300 that was constant divided by 4. So what's going to be the answer? I want you to guess. It's 75. The heart rate is 75. Okay, so this is for if the RR are constant everywhere. Now we're going to see that how we're going to calculate the heart rate where the RR is not constant, like in the sinus arrhythmia. So here we can see an ECG where the RR interval, that is not constant. Okay, it's different. It's different over here. It's 1, 2, 3, 4, 5 over here, but it's more than 5 over here. So what we're going to do in such case, because if we're going to apply the previous method over here, it will be different over here, it will be different over here. So what you need to do is that you need to count 30 large boxes starting from anywhere. Say, for example, we start from here, 1, 2, 3, 4 consecutive 30 boxes. Okay, say for example up to here it's 30. Okay, from here to here, say for example it's 30. Now you need to count the 30 large boxes. Okay, mark that one like that, and now count the number of R's in those 30 large boxes. It's 1, 2, 3, 4, 5. So 5, you need to multiply it with the 10. Here the 10 is the constant, okay, and 5 denotes the number of the number of the R waves in these 30 boxes. So that's equal to 50. Say for example, uh, the 30 large boxes, okay, if I start from here and it comes to here, okay, the 30 is here, okay, 1 2 3 4 5 up to 30 over here. Say for example, so I need to count the number of the R's in these 30 boxes. So it's going to be 1 2 3 4 5 6. So 10 is the constant, multiply by 6, that's going to give a number of 60. That would be the heart rate. Let's discuss with another ECG strip. Yeah, here you can see the above is the normal sinus rhythm and below is the sinus arrhythmia. Okay, so here you're going to calculate the R, the number of large boxes between 2 RR anywhere because they are constant. 300 multiplied by the number of large boxes between 2 RR. So it's 1 2 3 4 and 4.5, almost 4. It is 1 2 3 4 because here it is. So it's going to be 75. Here you cannot calculate it like this, okay, because the RR is not constant. Here you're going to apply the other method, that is counting the 30 large boxes. So starting from anywhere, you can start from here, you can start from here, you can start from here, but you have to continuously count the 30 consecutive large boxes. Say for example, we start from here, it's 1 2 3 4 5 and up to here it's 30. Say for example, so number of large boxes, this is 30, and I have to calculate the number of R's in these 30 boxes, 1 2 3 4 5 and 6. So here the 10 is the constant, 10 multiplied by 1 2 3 4 5 6, so that is 6, that is like 60. So that's how you're going to calculate the rate. So this was the lecture number 2. The next lecture is going to be about P wave and PR interval and the pathologies related to that.